Hey, what's up guys? Welcome to my channel. On this channel, I hope to demystify intricate concepts to everyday relatable analogies. On today's journey, we will discuss the overview of Alzheimer's disease, explore how comorbid disease states such as insulin resistance, such as diabetes, may increase the likelihood of developing Alzheimer's disease, and finally, the drug agronym in slowing down the progression of Alzheimer's disease. So Alzheimer is a progressive neurodegenerative disorder that primarily affects memory, thinking, and behavior. So it is thought that there are two main underlying mechanisms of action that causes Alzheimer's disease. Those are amyloid precursor protein and neurofibrillary tangle formation. We will explore those mechanisms of action shortly. To minimize further complication of Alzheimer's disease, clinicians need to be aware of both not only drugs, as well as management of comorbid disease states that may potentially worsen the progression of Alzheimer's disease. So, classes of medication that should be used in caution with Alzheimer's patients include antipsychotics, opiates, as well as anticholinergic medication. Anticholinergic medication decreases the release of acetylcholine neurotransmitters, which in essence completely counteracts the main mode of Alzheimer's therapy, which is to prolong the acetylcholine neurotransmitter activity within the synaptic space. So, avoid or decrease the use of opiates in Alzheimer's patients, as opiates decreases cognitive impairment. And in Alzheimer's patients, they are inherently already prone to cognitive impairment. Disease state management in regards to increase of sugar is important to decrease the further progression of Alzheimer's disease. It has been found that the release of insulin contributes to the microtubule destabilization, which further worsens Alzheimer's disease. Examples of such disease states include diabetes, depression, as depression stimulates the body to release cortisol, which in turn causes the release of sugar, and obesity, which contributes to insulin resistance. Insulin resistance is basically the amount of insulin that is needed to drive the same level of sugar down compared to a normal person. So, say for example, a normal person would need 1 unit of insulin to drive down 50 milligrams per deciliter of sugar into a cell, while an insulin resistant person may need 5 units to drive the same 50 milligrams per deciliter of sugar into a cell. The microtubules are a cellular infrastructure within the axons and are bounded by the tau proteins. Tau proteins helps hold all the microtubules together so that they may function as a railway for the transportation of cellular materials by kinesin, which is a motor protein from the cell body of a neuron to the synaptic ending. These transportation are known as anterograde transport, which packages neurotransmitters, synaptic vesicles, as well as mitochondria. We can actually envision the concept of anterograde transport by picturing a minecart transporting gold as a railroad example. The pins on the railway can parallel that of the protein tau, the minecart itself as the motor protein kinesin, and the railway as the microtubules. If somehow the pin comes undone, then the minecart can no longer transport the pile of gold from one tunnel opening to another. Just like the disruption of microtubules through various mechanisms that hyperphosphorylates tau can lead to the microtubule disassemblement. The disassemblement of microtubules can lead the microtubules to form neurofibrillary tangles. These neurofibrillary tangles, through hydrophobic interactions, have a tendency to cling on to each other. The dissociation of microtubules leads to the collapse of axons, and thus, as a result, a decrease in signaling conductivity, as well as neurotransmitter transportations that are important for postsynaptic transmission. So one theory behind the hyperphosphorylation of tau protein is GSK3, or glycogen synthase 3. In normal cell, GSK3 functions as a protein mediator that ultimately drives glycogen synthesis or the storing of sugar. The binding to the insulin receptor propagates the inhibition of GSK3. However, in type 2 diabetic patients, where the majority of patients are insulin resistant, the binding of the insulin to the insulin receptor is weakened, and as a result of the weakened signal, GSK3 will remain unphosphorylated or active. And as a result of the activation of GSK3 in neuronal cells, we can see from the pictures to our left, the activation of GSK3 will lead to tau's hyperphosphorylation, which thus triggers the destabilization of microtubules, which ultimately causes neurofibular tangles. The other pathological factor that contributes to the progression of Alzheimer's disease is the amyloid precursor protein. But before we dive into this concept, let's quickly recap the phenomenon between oil and water. Oil and water do not mix because when the oil molecules are placed in the water, they will exhibit a hydrophobic effect, which is the tendency of nonpolar molecules to aggregate in an aqueous solution. Let's utilize the same concept as we explore the concept of how beta amyloid proteins contribute to Alzheimer's disease. The picture on the left shows a breakdown of what enzyme as well as which part of the amyloid precursor protein is cleaved. And to the right, we have the broken down components of the protein and what functions they exhibit. So normally, amyloid precursor protein is cleaved by alpha secretase and gamma secretase, where the blue portion is the hydrophilic component and the yellow portion of the protein is the hydrophobic component because it's located within the transmembrane. And we know the transmembrane is hydrophobic due to the lipid bilayer environment. The cleaved protein contains both a combination of hydrophilic and hydrophobic amino acids, and thus has a neuroprotective function by preventing neuronal hyperexcitability by decreasing excessive calcium influx, as well as enhancing neuroplasticity. However, if there is an upregulation of either beta secretase or exposure of the beta secretase catalytic site through either mutation of the APP protein, which may affect the folding of the APP protein and thus expose more of the beta secretase catalytic site, then more beta amyloid protein will be produced as a result of. So based on the cleaved protein by beta secretase and gamma secretase, we can see that the cleaved proteins are hydrophobic. Thus, they have a higher tendency to aggregate, otherwise known as the hydrophobic effect. Consequently, the accumulation of beta amyloid plaques within synapse will have the potential to disrupt neuronal synaptic transmission, as well as contribution to the heightened levels of inflammation and oxidative stress. In terms of pharmacological therapy for Alzheimer, there are currently no therapy that cures the disease, but can only treat either the symptoms or delay the progression of Alzheimer's disease. The drug acronym spells out NEAR, as an Alzheimer patient is near memory loss. N for Namenda, E for Exelon, A for Aricept, and R stands for Rezidine. Aricept, Exelon, and Rezidine are used to treat mild to moderate Alzheimer's disease. This class of medication inhibits the enzyme that degrades acetylcholine, otherwise known as an acetylcholinesterase. Normally, acetylcholine is hydrolyzed into the acetic and choline group within the synapse. So in order to increase the duration of signaling in the postsynaptic cell, acetylcholinesterase inhibitor is given to prevent the breakdown of the neurotransmitter acetylcholine. So the prolonged signaling would lead to a prolonged activation of the acetylcholine receptor on the postsynaptic neuron. For moderate to severe Alzheimer's disease, an acetylcholinesterase inhibitor in addition to an NMDA antagonist can be utilized. Because there are already a loss of cholinergic neurons in Alzheimer's patients and an excessive depolarization or overexcitability of neuron will lead to an even more destruction via mitochondrial activity and thus would lead to an influx of calcium, which leads to overexcitability of depolarization, which further translates to the destruction of the cholinergic neurons. NMDA receptor antagonist prevents the overexcitation of neurons and thus the preservation of cholinergic neurons, which delays the onset of Alzheimer's disease. Thank you for watching. If you found these videos to be helpful and enjoyable, please consider subscribing and hit that notification bell to stay tuned for future videos. Please comment below and let me know what other content you would like to see next. And as always, let's continue to empower a different way to envision success. And I'll see you on the next one.